Early diagnosis and prompt treatment of deep vein thrombosis is very important. Clots in the deep veins of the legs can travel to the lungs, causing pulmonary embolism and death. In fact, pulmonary embolism is second only to heart attack as a cause of sudden death. The media seems to regularly report the unexpected death of apparently previously healthy people from DVT. Now, what is striking to me is that in many of these reports, people who are suspected of having a DVT have already sought medical advice and raised the possibility of DVT, but they were dismissed. Now, there's no doubt that DVT is difficult to diagnose on occasions. Sometimes the signs and symptoms are subtle and they may point to other problems such as muscle injury or cramps. Many GPs and other non-specialists may only see a very few number of cases of DVT in their whole professional career, so it's unfair to blame family doctors and others when they sometimes get it wrong. That's why vein experts and the National Institute for Health and Care Excellence have produced guidance. If all doctors were to use this guidance, DVTs could be diagnosed much more quickly and with more accuracy. In this video, I will give you all the information you need to ensure that your doctor follows this advice. If you go to your doctor or nurse with a suspected DVT, ask for a clinical assessment using the Wells score. Your doctor should ask you your medical history and examine you, and using this scoring system, the diagnosis of DVT will be calculated as being either likely or unlikely. Now, you can read the Wells scoring system on the NICE website and print it off to take to your doctor. Here I show the scoring system, and you can either pause the video now or you can read it on the NICE website. I'll put the link in the description below. Ask your doctor if he knows the Wells scoring system and ask him or her to tell you your score. In addition to your Wells score, you should have a blood test called a D-dimer. It's raised in people with DVT, and in conjunction with a Wells score, your D-dimer blood test will determine whether you should have an ultrasound scan of the deep veins of your leg. What happens after your Wells score and the D-dimer test is described on the NICE website, but I show it here and I tell you what should happen if your score is likely or unlikely. Pause the video to look at it in detail, or print the advice off from the NICE website. Make sure your doctor follows this advice, and if he or she doesn't, ask why. Also, if you do need a leg scan and there's a delay of more than 4 hours, ask your doctor to start blood thinning injections. So in summary, if you think you have a DVT, ask your doctor or other healthcare professional to apply the Wells scoring system in addition to a D-dimer blood test, and to follow the advice on the NICE website. Insist on having an explanation if this advice is not followed. Ask questions. I don't think it's too dramatic to say that the information in this video may save your life. I hope you found this useful. My name is Dr. Haroon Gadraj. Thank you for watching.